11th Annual AMCP Western Regional Student Conference.
What makes this so special is this really is a student conference. It's planned, designed, created, fundraised by the students. By the time a student enters school and the time they graduate, there's already 2.5 to 3 times as much information out there that you weren't, creating for those students. And so that really means that we have to create students who are lifelong learners.
Character, ethics. You're going to be involved in making decisions, not for one patient, but for tens of thousands, hundreds of thousands, maybe millions of patients. You have a role. You're getting a role with 493 and all of that to be providers. It is a mixed bag. You also have risk. You're going to have to deal with that risk. I have enormous respect for the fact that you will be able to handle it. But understand the drivers, understand the assumptions, understand what's going on, and then pick your role and come out with it. Do not be afraid to talk to the doctor. Do not be afraid to talk to the insurance company with a well-reasoned argument from what you do.
I'm just curious to know a little bit about how specialty pharmacies deal with diagnostic companies when you're dealing with a drug that has a diagnostic test.
So we look at a lot of the labs and diagnostic tests to make sure that the dosing is appropriate. Part of specialty pharmacy is the prior authorization department. So they do work closely with us, and a lot of these medications are reviewed by pharmacists before they're actually approved.
Because I'm in ACOs across California and I talk to many medical groups, they love to hear about what other groups are doing. So that's another value is, we're seeing what works and doesn't work, and so we're kind of collecting a whole bunch of good information that we can share across our group. It becomes real collaborative and exciting that we can get all these different pieces of information from the patient and put it all together for that care team, for the case manager. To be able to go, okay, I'm now going to turn you over to the pharmacist and let them help you, they're going to help you monitor your medications and get you to goal. I sell it as it's an incredible, it takes a lot of burden off the primary care physician to have that pharmacist partner.
In order to expand Medicaid, the way that they accomplished that was by raising the income threshold from 133 to 138% of the federal poverty level. So people that were previously made too much money to qualify for Medi-Cal, they gave a 5% bump in that income where they could qualify if they made a little bit more money. It also removed the assets test so that somebody who owned a car or maybe owned a home but they have a low income can now qualify. And also adults without children can now qualify for Medi-Cal, where before they could not. They had to have a qualified child. Medi-Cal is open year-round. There is no waiting period and there's no special enrollment period for Medi-Cal. If somebody is qualified for Medi-Cal, they can enroll at any time. And they can do that through Covered California. It can be done online through their application process or through a certified agent. Any way that somebody would normally apply for Covered California, they can do the same with Medi-Cal through those same avenues. They're calling that a no wrong door approach, so that people have one place where they can go, regardless of what product they end up with at the end.
Transitions is a wonderful way. We're talking about bridging gaps today and collaborating. Transitions is a wonderful way for us to collaborate because our pharmacists are spending time with the doctors and the nurses in the hospital, with the patient at the bedside, and they're also following up with the community pharmacy to make sure that they can get their medications when they need, make sure the prior authorizations are covered. So this is a great example of where, having full coverage for the patient really makes sense. Basically, if your patient is an adult, you test them, and if they find hepatitis C, we treat them. That's kind of the easy method on that. It used to be right? Easy, right? Well, obviously the new medications came out recently, and suddenly we have these medications that are 90% effective, have much less side effects, and the patients only have to take them for 3 to 6 months. Now it's looking a lot more exciting, so patients are banging down our doors trying to get these treatments, especially now that they started doing all the stuff on TV saying, it could happen any minute. It sounds like a shark is coming to get you, Hep C might get you, So all these patients are calling up, Hep C is gonna get me, So needless to say, we've got a huge group of people that want to get treated. So we actually started the Hep C program. We started a pilot in January with just that one pharmacist and those 2 pharmacy technicians. We actually planned to do 8 patients to kind of see how it worked, make sure we could actually get it done, and if it was going to be successful, then we would start to expand out again in July. Well, that number is actually deceiving. We actually ended up seeing 180 patients now with that same, it's actually only a half-time pharmacist and 2 technicians over the last couple of months. So people have just been shoving their patients into these programs, begging and pleading to get them in because they're just so desperate to get treatment. So I just tell people every time I see students now, do a residency. It's super important. It's one of the most highly valued things you can do for yourself. It's 1 year and you can make it. I know you can. So definitely do that. We definitely need to start, getting the level up for just pharmacists in general. So pharmacists not only in the inpatient setting, but the outpatient, ambulatory care, the community, the retail, all of them need to start stepping up the game. If we really want our profession to be taken seriously, we need to all get residencies. We need to all start taking these tests and really show that we are somebody that the doctors can trust.
The need to get into residencies. Before, 10 years ago, you just need a PharmD. You get a degree, you go into pharmacy setting. They would love to get you in if you have the enthusiasm, the passion, and the knowledge, and you're smart. If you dress well, go into the interview setting. But nowadays, I think they really look for a residency. They really look for some clinical background and experience. So later on, again, that trend is going to continue. They're going to want to see what type of experience or expertise you're going to bring into my department because I'm going to have higher clinical needs. SB 493. At the community pharmacy setting, I think this is a big thing for them because finally, if they care enough to sign the collaborative protocol with the physicians around their practice, they can actually start billing. They can have the lab clear waiver, and they can start, if they identify payer that's willing to pay them for the cognitive services. So this is a big thing, and again, from the providers, from the payer's perspective, I am always looking for good pharmacists out there that are passionate about this.
We're being told it's probably one of the most progressive pieces of healthcare professional legislation in California in the last 25 years. So the really important part of 493 is it allows you to practice outside of a health system. So previously those authorities were granted only if you're working in a hospital and health system through privileging and through collaborative drug therapy management agreements. So what this does is it allows now in any setting, under any situation, community, retail, working as an employee in a physician group practice, an accountable care organization. This sort of takes it outside the walls of the hospital, and that's really the landmark part of what 493 meant. So we're not trying to fragment care and pull pharmacists off. Actually, what we're trying to do is put pharmacists in the circle where all sorts of healthcare providers have been collaborating for a long time.
Maximizing therapeutic benefit, minimal affordable risk, the most affordable cost. So knowing that managed care is everywhere, managed care is going to affect you no matter where you practice. You heard a lot about this today too. Knowing your role, knowing your value, your involvement. How many of you are in multiple organizations right now as a student? I think almost everybody, right? AMCP, CPHA, CSHP, ASHP, NCPA, rattle them all up, acronyms. A very good conference today with a lot of great speakers in terms of learning about where managed care is going, where it came from, what we can do, what is your value. Think about that. The collaboration to show the value in improve the outcome, and it helps the entire system.
Although we may understand what networking is, and we may have heard of the definition, the question now is how do we appropriately network so that it benefits our professional development? Or more importantly, the why behind it. Why are we networking? What is it supposed to accomplish? You know, how many of us are getting the most out of our professional network? It's not what you know, it's who you know. I'd like to make a little addendum to that. It's not just what you know, nor is it who you know, but it's what they know you're capable of doing.
Pin it down to just one thing because there's so many things you can learn in conferences such as this. And one big thing was reinforcing the definition of managed care pharmacy, which I think is really important because not a lot of people do know the definition. And the second thing was pretty nailed down into our minds with the last speaker is being more confident in yourself, confident in what we know and our clinical abilities and our talent in being able to socialize with patients and connecting them on a deeper level. So that's definitely two major things that I think is something to learn about from this conference.
The biggest thing I learned from this conference, well, first off, it was a pretty well-rounded conference. It kind of went over a lot of things I had heard about before, but a little bit more in depth. Well, I think what's unique about this conference, as opposed to something we would have at our own individual schools, is the perspective of students from other schools. So that I felt was just as valuable as learning a little bit more about managed care, but kind of the student perspective from other schools that have different internships, have heard from other managed care professionals and kind of gave their insights as well and kind of shared some of their experiences. So that's pretty unique and it was awesome.
My favorite part of the conference was listening to all the speakers and meeting new people, and we learned a lot about managed care and what it means in pharmacy.
Same with me, so my favorite part was definitely being able to learn more about managed care. I wasn't too sure about it before coming here, and also meeting new people like we just met, and now we're doing this together. So.
Thank you. Did you guys enjoy the conference today?
We did enjoy the conference. There was good food and it was fun and informative.
I definitely have enjoyed the conference so far. It's really, really cool. It's also in my hometown, which helps. I want to help show people around as I get to know them more, and then it's also cool, of course, to learn more about managed care.
It was very informative. I learned a lot of things I didn't know in the beginning, like how to, portray yourself, make yourself stand out from others when you go for an interview. And then in my country, we don't really do any residency stuff, so I learned what residency was about and how it applies to you and how you use it. I learned about managed care, which I've never heard before. In Ghana, everything is it's a whole system, so it was very informative. I learned about managed care and how there's residency in managed care, and I learned some pointers like how to follow your passion, get good skills, be confident, be able to communicate well, network yourself with others, like to meet people, study hard, strive to be the best in what you can do.
So For me, for this conference, learning about the different residencies for managed care was very interesting. I didn't really know much about that. I was mostly exposed to the typical residencies, acute care, general practice, I think farm practice, all those ones. But learning about the managed care organizations kind of taught me what I can do regarding a career in managed care, because the residents were really passionate about it. The directors gave a lot of information regarding what it takes to apply and interview for these organizations. So I really like that.
So my perception of managed care before, I feel like was pretty limited. But hearing all the different opportunities that were presented by the different speakers, and also all the ways to get to where I want to be, whether it be residencies, fellowships, or other programs and certifications, has really shaped my perception of what managed care is, changed my point of view, and I feel like I've learned a lot. I feel like I'm going to walk away a lot brighter and a lot smarter.